Welcome to TCM Board Formula Series. Today we review Jin Gui Shen Qi Wan, Kidney Qi Pill from the Golden Cabinet. It belongs to the category Warm and Tonifa Kidney Yang. The herb photograph shows Fu Zi botanical, Aconitum carmichaelii, formula uses processed lateral root only. The fastest memory hook is this. Lu Wei de Huang gains Gui Zhi and processed Fu Zi to kindle kidney yang within a yin nourishing base. By the end, you should recognize the core ingredients, formula hierarchy, pattern picture, major differentials, and modern safety checks. This lesson is for board preparation and professional education. It is not a diagnosis, prescription, or substitute for individualized medical care. Build the formula from its ingredients. Shu de Huang nourishes kidney yin and essence. Shan Zhu Yu nourishes liver and kidney and secures essence. Shan Yao supports spleen and kidney. Zi Xia drains turbidity and balances Shu de Huang. Mu Dan Pai clears constrained deficiency heat. Fu Ling supports the spleen and drains dampness. Gui Zhi warms and opens yang transformation. Processed Fu Zi strongly restores and warms kidney yang. On an exam, do not memorize the list as isolated names. Link each ingredient to the treatment strategy. The composition should explain why the formula fits its pattern and why a similar formula does not. Now organize the hierarchy. The chief is Shu de Huang. The deputy level is Shan Zhu Yu and Shan Yao. The assistants are Zi Xia and Mu Dan Pai and Fu Ling and processed Fu Zi. The envoy role is Gui Zhi. Together, the formula warms and tonifies kidney yang, supports qi transformation, promotes fluid metabolism. A useful board habit is to ask what the chief attacks or tonifies, what the deputies reinforce, and how the assistants control side effects or protect the middle. The target pattern is kidney yang deficiency with impaired transformation of fluids. Look for this clinical picture: cold low back and weak knees. Cold limbs, fatigue, and aversion to cold. Frequent urination or urinary difficulty. Edema, dizziness, or shortness of breath in the full pattern. The tongue is pale, swollen, and moist. The pulse is deep, weak, and slow, especially weak at the qi positions. The board answer comes from the whole pattern, not one symptom. Match the disease mechanism, the treatment strategy, and the tongue and pulse before selecting the formula. Differentiate carefully. Lu Wei de Huangwan a Euro kidney yin deficiency without cold or yang failure. Yu Gui Wan a Euro more severe kidney yang and essence deficiency with less draining. Zhen Wu Tang a Euro spleen kidney yang deficiency with dominant water retention and dizziness. When two formulas seem close, identify the single feature that changes the treatment strategy. Ask whether the presentation is excess or deficiency, hot or cold, exterior or interior, and whether phlegm, dampness, food, blood, or sinking qi is the main driver. Safety is part of formula knowledge. Classical cautions include: only professionally processed Fu Zi may be used. Raw or improperly prepared aconite can cause fatal arrhythmias and neurologic toxicity. Numbness, vomiting, weakness, palpitations, chest pain, or dizziness after aconite exposure requires emergency care. Avoid self-prescribing in pregnancy, arrhythmia, severe heart disease, or unexplained edema. Modern medication review includes: aconite is unsafe with antiarrhythmics, digoxin, stimulants, and many cardiovascular drugs without specialist oversight. Review diuretics, antihypertensives, and renal function because the formula changes fluid handling. Use a verified product, document the complete medication and supplement list, set monitoring parameters, and refer when red flags exceed the scope of routine herbal care. Formula names do not guarantee identical composition or concentration across products. Finish with 5 board pearls. Number 1, Lu Wei Base and Gui Zhi and Fu Zi. Number 2, Kidney Yang Deficiency. Number 3, Cold and Fluid Dysfunction. Number 4, Deep Weak Pulse. Number 5, Processed Aconite Only. The one-line recall is, Lu Wei de Huang gains Gui Zhi and processed Fu Zi to kindle kidney yang within a yin nourishing base. Review the ingredient architecture, then practice distinguishing the nearest look-alike formula. This concludes Jin Gui Shen Qi Wan. Save this lesson for spaced repetition, and always connect board memorization with safe clinical judgment.